Welcome to Lesson 2 on the skeletal system. Here we will conclude with the structures of the axial skeleton, including the vertebral column and the thoracic cage.
The vertebral column. You may have heard it called the spine, the backbone, or the spinal column. They're all the same thing. These are the bones that you can actually palpate or feel as you run your hand down your back in the midline. The vertebral column is made up of 26 vertebrae in the adult, and they function to protect the spinal cord. So the spinal cord runs through a passageway within those bones. The vertebral column supports the head. We saw that the skull rests on the vertebral column through the occipital condyles that rest on cervical vertebra 1. The vertebral column also serves as an attachment point for the ribs in the thoracic region, the pelvic girdle in the pelvic region, and several muscles and tendons that move and support the trunk. The vertebral column is curved in the anterior-posterior direction or in the sagittal plane to varying degrees in different locations. So in the adult, there are 4 curvatures. We will discuss these further. But the curves increase the column's strength and create flexibility. They also help to maintain balance in the upright position. And these curvatures allow the spinal column to respond to shock during walking and help to protect the vertebrae themselves from fracture. Let's look at it on the next slide. So in a healthy individual, if you were to look at the vertebral column from an anterior, in this case, or posterior view, the vertebrae would be stacked linearly on top of each other. So in this way, the vertebral column is straight. But in the diagram to the right, you'll see that in a lateral view, looking at the column from the side, the vertebral column in the adult actually has 4 curvatures. You have the cervical curvature, which then curves the other way to form the thoracic curvature, which curves in the opposite direction to make up the lumbar curvature. And finally, we have the sacral curvature. And these curvatures relate to the 4 major parts of the column. Well, let's say 5. Superiorly, we have the cervical region, which is made up of 7 cervical vertebrae. Inferior to that, we have the 12 thoracic vertebrae. These all articulate with the ribs. So each pair of ribs articulates with the thoracic vertebra. Inferior to that, we have the larger vertebrae that make up the lumbar region, 5 of those. And you can see that those little gray discs between them are the intervertebral discs made up of fibrocartilage. So these separate the vertebrae, reduce shock, and allow for flexibility of your spine. The next region is the sacral region, which is made up of 5 fused bones. So that gives you 1 large sacrum, a triangular shaped bone, and this is where the 2 coxal bones articulate, the pelvic girdles articulate with the vertebral column. And the 5th region is just 1 bone, which was really 4 bones originally that fused together to form the coccyx, commonly called your tailbone. So together the sacrum and the coccyx form that last curvature. Further discussion here on the curvatures of the vertebral column. When an infant is born, they come out with 2 curvatures. These are the fetal curvatures. These are also called the primary curvatures. They are in the thoracic region and the sacral region. And these are both in the same direction, as you can see. So that creates a single curve in the fetus. The thoracic and sacral curvature are present at birth and persist throughout life. And if you look, that's how a baby kind of looks when they come out, right? We call this the fetal position. As the child develops, they will develop the next 2 curvatures, which are the cervical curvatures. The child begins to lift their head at about 2-3 months and hold their head up. That will develop their cervical curvature, which is opposite to the thoracic curvature. And then a few weeks later, at about 4, 5, 6 months, The child is going to learn to sit and stand up. That will develop their lumbar curvature. So the two convex curvatures, the cervical and the lumbar, develop with these infant milestones. Okay, learning to lift the head develops the cervical curvature, and learning to sit up and stand develops the lumbar curvature. So in the adult, we have all four curvatures. The two concave, which were present at birth, the thoracic and sacral, as well as the developing convex curvatures. Note, however, that as the individual ages and gets to become an older adult, the secondary curvatures, cervical and lumbar, actually disappear. So the head begins to bow down again and the client begins to stoop over. So the expression is once a man, twice a child. And that refers to their behavior as well as their needs, and in this case, their vertebral column anatomy. So the primary curvatures, again, are present at birth. Those are the thoracic and sacral. The secondary curvatures develop with the child's development, cervical and lumbar curvatures, and the secondary curvatures diminish towards the end of life as well. The vertebral column can develop abnormal curvatures, shown here. So in panel A, we have scoliosis. This condition tends to be more common in adolescents, and for an unknown reason is also more prevalent in young girls. Scoliosis is a lateral curvature of the spine. It can result in an S curve if it curves to the left superiorly and to the right inferiorly, or vice versa. Or some individuals just develop one curvature and it's like a C. That can be corrected by the use of braces that force the muscles and the spine back into position, but often it must be corrected surgically. In image B, we have kyphosis, which is an exaggerated thoracic curvature, kyphosis. This can lead to what's called hunchback, okay, where the thoracic curvature is exaggerated. And finally, in image C, we have lordosis, sometimes called swayback, and this is an exaggerated lumbar curvature. Lordosis tends to develop in individuals that are carrying an increased abdominal weight. So if people put on weight in their belly, such as the beer belly, or in pregnant women, as the uterus grows with the fetus, that causes a shift in their center of gravity, which leads to temporary lordosis. So again, these are abnormal curvatures of the spine. Yes, so we mentioned that the vertebral column consists of 26 stacked bones in the adult. There are 7 cervical vertebrae in the neck region, 12 thoracic that make up the posterior aspect of the thoracic cavity, 5 lumbar vertebrae that support the lower back, 1 sacral bone or sacrum, that is actually 5 fused bones, and these articulate with the pelvic girdles. And finally, there's a single coccyx bone, which was 4 individual bones that fuse together. Each vertebra usually has these parts. The body, which is the more circular part of the vertebra, and these are the parts that stack on top of each other and form the weight-bearing parts of the vertebrae. There's a vertebral arch, which is formed by processes extending from the body, and together they form what's called the vertebral foramen, which is a passageway for the spinal cord. And then we have several processes: the spinous process posteriorly, the transverse processes off to the side. These act as attachment points for muscles and ligaments. Let's see one on a diagram. On the left, we have a representative vertebra or vertebral bone. And this is a superior view, so you're looking down at it. And you can see the relatively large body, which is made up of a thin outer layer of compact bone surrounding a spongy bone core. Extending from the body laterally are the two pedicels, which then merge posterior medially as lamina to form the spinous process. And together, the lamina and pedicel make up the vertebral arch. The passageway, the circular space formed by the vertebral arch, is called the vertebral foramen, and that is the space through which the spinal cord runs. So what you see there is a transverse section through the spinal cord. But think of the spinal cord as a string being suspended through the foramen magnum of these vertebrae, which are stacked on top of each other. And together, the stacked foramen make up the passageway called the vertebral canal. So that is that passageway or that cavity for the spinal cord that we met earlier when we were looking at cavities. Extending from the vertebral arch, we have transverse processes. Again, these act as attachment points for muscles and ligaments, as does the prominent spinous process. So when you run your hand down your spine, the bump that you're feeling are the sequential spinous processes of the various vertebrae. Also note that the vertebrae have articular processes and surfaces, facets for articulating bones. So here is where the ribs would articulate, or the processes of adjoining, or adjacent would be a better word, adjacent vertebrae. Let's look at the diagram on the right. So this is a lateral view, posterior lateral view of the vertebral column. So here we have three stacked vertebrae. You can see their prominent spinous processes and the transverse processes and the various facets. Okay. Also note that between each pair of vertebrae, you have a pad of cartilage, and that's the intervertebral disc. So that's the specialized joint between the vertebrae that provides cushioning, shock absorption, and flexibility. You'll also note that there's a space between adjacent vertebrae. That is called the intervertebral foramen. So remember that foramen is a passageway. And that intervertebral foramen is a passageway that allows the spinal nerves to branch off of the spinal cord and exit the vertebral column on the way to the peripheral structures of your body. So again, the intervertebral discs separate adjacent vertebrae one from another and are located between the bodies of the vertebrae, beginning at the second cervical vertebra all the way to the sacrum. The intervertebral discs function to absorb shock while creating flexibility within the vertebral column. Each intervertebral disc is made up of an outer ring of fibrocartilage called the annulus fibrosus, which surrounds a soft, pulpy region called the nucleus pulposus. The nucleus pulposus is a region that really absorbs the shock, while the annulus fibrosus allows for compression of the disc while limiting it at the same time. You'll notice that the stacked vertebrae form a space, a passageway that we mentioned on the previous slide called the intervertebral foramen. So this is where the spinal nerves would branch off the spinal cord and exit the column. If there is a tear in the annulus fibrosus, as it is compressed, some of the nucleus pulposus could actually be squeezed out and compress those spinal nerves, causing pain, numbness, or even weakness or paralysis. A tear in the annulus fibrosus that allows some of the nucleus pulposus to squeeze out is called an herniated disc. Here we will summarize some special features of each region of the vertebral column. So again, the cervical region contains 7 vertebrae named C1 through C7. The first 2 are unique. They have special names. C1 is called the atlas because as the first cervical vertebra, it is actually supporting the skull, just like the Greek character atlas that supported the world on his shoulders. Inferior to the atlas, we have C2, which is called the axis, and it is unique because it fits into a space within the atlas, allowing for rotation of your head to indicate no. The occipital condyles resting on the atlas allow you to rock your head forward to indicate yes. You can also rotate on it to say no, or tilt the head side to side, move the head around. So the occipital atlas joint, formed by the occipital condyles of the skull and the atlas, is a very free-moving joint, while the axis joint is only a rotational or pivot joint. The thoracic region has 12 vertebrae. These are a little wider and stronger because now they are supporting the 7 cervical vertebrae as well as your skull. The thoracic vertebrae articulate with the ribs posteriorly. The lumbar region has 5 large, strong vertebrae. These are weight-bearing vertebrae. These also provide attachment points for the large muscles of the back. The sacrum is that triangular bone that serves as an attachment point or an articulation point for the pelvic girdle or the 2 coxal bones. And finally, we have the tiny triangular shaped coccyx, again called the tailbone, which is formed by the fusion of 4 coccygeal bones. On this slide, we have diagrams depicting some of the unique features of the first vertebrae, or the 2 initial cervical vertebrae, C1 and C2. So at the top right of the page, you'll see a superior view of the atlas or C1, and it's missing something. If you look at the center of it, there is no body to the atlas. Instead, it has a very large vertebral foramen, and that is to, 1, accommodate the width of the spinal cord as it exits the skull. Also, it accommodates a process called the dens that protrudes up from C2 or the axis. So the body of C2 is a modified structure called a dens, and dens is Greek or Latin for tooth. So it looks like a tooth, single tooth, sticking up into the space created by the absent body of C1. And this is where we form the pivot joint. It's properly called the atlantoaxis joint, that pivot joint that allows one to rotate their head, which is really a rotation of your vertebral column, to indicate no. We also have the large superior facets on C1 that support the occipital condyles. Down below, we have a superior view of a typical vertebrae that has a visible body. Posterior to that, you have the vertebral foramen, which is the opening for the spinal cord. And then you have the pedicels and the lamina that form the vertebral arch. And you also have your spinous processes and transverse processes. We will finish up this lesson by discussing the structures that make up the thorax, also known as the thoracic cage or the rib cage. The thoracic cage is formed by the sternum anteriorly, the ribs, which run from the sternum laterally and posteriorly to the thoracic vertebrae, and the ribs connect with or articulate with the sternum through large pieces of costal cartilages. The cage collectively functions to enclose and protect the organs within the thoracic cavity. So those are the lungs, the heart, the thymus, the esophagus, trachea. What else do we have in there? The aorta and the vena cava. But because of the anatomy of the ribs, which actually flare inferiorly as they move posteriorly, the rib cage also provides partial protection to the more superior abdominal organs, such as the liver and part of the kidneys. The cage also supports the bones that attach the upper limbs to the trunk. So the pelvic girdle bones articulate with the bones of the thorax. And the thorax, the bony cage, is critical for breathing because the bones and the muscles that run between them form the thoracic wall to which the parietal pleura is attached. And as the muscles move and contract and pull on the bones and change the diameter and volume of the thoracic cage, it increases the volume of the lungs, which changes the pressure in the lungs, and that change in pressure now creates a gradient for air to move in. When those muscles relax and the volume of the thoracic cage decreases, it decreases the lung volume, which increases the pressure on the air in the lungs and causes air to move out. So the attachment of the lungs to the structures of the thoracic cage is absolutely vital for the mechanics of ventilation or breathing. The sternum is the medially located breastbone located in the center of the thoracic wall. It consists of three regions. Superiorly, we have the manubrium, which looks like the knot of a tie, and it articulates with the clavicle bones as well as the first pair of ribs. Most of the sternum is the body, which articulates with rib pairs 2 through 7 through costal cartilages. And the tip, the distal tip or the inferior tip of the sternum is called the xiphoid process. And that's the little part of the sternum that can be broken off with chest compressions if the palms of the hands are placed over the xiphoid process. It can potentially puncture a lung, but if one is performing CPR, we'll worry about collapsed lungs later. Right now, we got to keep the blood circulating and air flowing through the respiratory tract. The ribs come in 12 pairs. So you actually have 24 ribs if you do the math, and they give structural support to the sides and posterior aspects of the thoracic cavity. Running between the ribs, we have 2 layers of muscle, and these are the muscles that contract and relax for breathing. The ribs attach to the sternum via costal cartilages, which is specialized hyaline cartilage, and this cartilage contributes to the elasticity of the thoracic cage, which again is very important for allowing expansion and recoiling of the cage during breathing. Here we have diagrams of the sternum on the left and the thoracic cage on the right. In the diagram of the sternum, you can see the superior manubrium, and inferior to that we have the body, and the inferior or distal tip of the sternum is called the xiphoid process. And hopefully from this diagram you can see why the sternum is classified as a flat bone. Now in the diagram on the right, we can see that the sternum lies medially and articulates with most of the ribs through costal cartilage anteriorly, while the ribs curve around posteriorly to articulate with their corresponding thoracic vertebrae. Rib pairs 1 through 7 articulate via costal cartilage that attaches directly to the sternum. So those are called true ribs. While rib pairs 8 through 10 have costal cartilage that first fuses with the cartilage of rib pair 7 before attaching to the sternum. So those are called false ribs. And if you look carefully, rib pairs 11 and 12 do not articulate with the sternum at all. They're just hanging out there. So those are called floating ribs. All right, let's finish our discussion of the axial skeleton and the thoracic cage specifically by considering the ribs. The ribs provide support to the thoracic cavity. Essentially, the ribs form the walls of the thoracic cavity. There are 12 pairs. Each of them articulates posteriorly with the thoracic vertebrae, and 10 of them articulate anteriorly with the sternum. The bony portion of the ribs join up via costal cartilage to attach the ribs to the sternum anteriorly. for rib pairs 1 through 10. Again, the first 7 pairs are called true ribs because their cartilage directly connects to the sternum. Pairs 8, 9, and 10 are called false ribs because their cartilage is indirectly connected to the sternum via the cartilage of 7. And pairs 11 and 12 are called floating ribs because they do not connect to the sternum at all. And those are the most susceptible to injury because they have less support.